And even though we feel it in our body, it still is a product of the brain. But in chronic pain, the brain starts to become fixated or wired or hypersensitive to this pain, expectation, if you will. And the tissues actually react to that expectation, which grows the sensitivity and changes the input perception to be more of that of pain, and it becomes this vicious cycle. And so rather than just masking that phenomenon with a drug or trying to address it at the tissue level, our technology allows us to retrain the brain. Essentially, it works like an artificial nerve, and it generates a dynamic set of artificial nerve impulses that mimic endogenous or natural no-pain nerve signaling in the body. We attach electrodes on the skin in proximity to the pain, but actually in healthy tissue. So that's one point of divergence from most other, electrical stimulation or, electroceutical, as you call them, therapies that are trying to, kind of work on more of the gate control theory of pain or masking the pain at the pain site. We're actually just trying to give the brain specific but new information. So we attach electrodes on the skin, we turn the device on, and it transmits this information through the nervous system, through the periphery, up through the central nervous system, and into the brain. And in a relative, matter of minutes, short amount of time, the pain experience is diminished, typically in a pretty noticeable way. Once we have that reduction in pain, we know we have the positioning right and the patient's fairly comfortable. They sit there for about 40 minutes, and over that 40 minutes, their brain is flooded with a dynamic and changing set of information. And this is also, I think, a point of differentiation, is that the messaging is not static. It's not just a one-time waveform change of intensity or algorithm, but it's driven to change in dynamic information. And so that causes the brain to have to work to understand and interpret what is happening. And that really is what drives the neuroplastic change that ultimately allows us to have lasting or durable relief, because the brain is kind of having to adopt and learn this rather than just start to ignore it as background noise. So we're giving the brain new information, and essentially through the principle of neuroplasticity, over repeated sessions, typically over a few weeks, the brain adopts a more normalized perception of pain. We're able to drive that pain response down in the body. In fact, we average an 84% reduction for hundreds and hundreds of clients with almost all types of chronic pain. This is pretty remarkable results. And along that journey of a few weeks of daily sessions, educating them about all the things that kind of feed their brain in terms of their sleep and their environment and their nutrition and their movement and their attitude in some ways. And, pain is a very complicated thing. And we feel fortunate to have such an elegant and safe, effective way to do it, while simultaneously really helping them begin to think differently about their own pain experience too, and be empowered to take control about it.
A lot of the things that Brendon, is talking about, even if he isn't a physician, there is a lot of education that I know that Brendon, I think we've been talking for the last year or two, and you've been extremely passionate and willing to learn and put yourself out there for the better good. And a lot of this neuroscience of pain, I know that stems from, Lorimer Moseley and David Butler, Explain Pain, the Explain Pain Supercharge. There's Painful Yarns. There's the Protectometer. I could put all these in the notes, but everything that you're saying, Brendon, has been defended by a lot of the neuroscience of pain that's out there. And
you're absolutely right. And it's not because that science isn't true and valid that more people don't know it. It's because we have industry that's built around economic incentive to continue to do what they do. A pain doctor, for example, they're trained typically in biochemistry, in drugs, right? They're many times anesthesiologists. I know you're a boarded anesthesiologist. But they think of it in those terms. They become a little bit myopic. And even on the side of, I think historically speaking, even on the side of the alternative care physicians or clinicians, they're trained also and become myopic in their own discipline and approaches, right? And they become entrenched in those, and there's an economic return, whether it's reimbursed or they just have a payment model set up. So adoption of something new and migration away of something that is known and established is very, very difficult. And that's part of the reason that we've chosen to operate outside of the confines of that traditional healthcare environment, or even alternative. I mean, we're building our own clinics around this, which allow us to create a whole new experience for our clients and to operate on our terms. We don't have insurance coverage for the therapy, which to some is like a turnoff. But for most of our clients, especially when we start talking about their why and their goal, they realize, okay, I might be spending money out of my own pocket, but I'm investing in myself. I'm investing in this why. I'm investing in my future. And I think that that creates a psychological shift that empowers them even more, and it makes it even more real for them, you know? And I think I am passionate about this, so passionate about, because I've been treated. I know the relief that I've experienced, and my pain is mild compared to so many other people's, but I've seen literally hundreds of people in such severe pain coming in and so skeptical, being able to go back to work, being able to do the little things like stand at the kitchen sink and wash dishes, being able to be intimate with their companion. Dr. Farley and I have written a book, which is available on Amazon here shortly. As of the end of August, it'll be available, called Radiant Relief, A Case for a Better Solution to Chronic Pain. And it's written for the layperson, but hopefully many professionals and clinicians will read it too. It talks a little bit about the science. It talks about the economic challenges that have driven policy and therapy that we have available, and and our thinking and our evolution and our business to say, like, maybe we can look at this differently, and fortunately have a technology that we can work with now. And as we continue to develop new technologies, incorporate those into our model and really hopefully help build a safer, more effective therapy. I try to make the book, frankly, a fairly personal story. I mean, like trying to take my own personal challenges in my life, the health challenges that my wife has dealt with for so long, which really have informed how we've approached modeling Radiant, and also just give us a higher level of, understanding of what our clients go through when they have faced years of no answers or hope and then dashed hopes because the therapy hasn't helped them. You become very sympathetic and very empathetic to those experiences when you've in some way lived through them. And so the book is as much that. And I think in some ways, maybe it's a personal development story in some ways too. And I think that's good, because I think that anything that we're doing to help break up these neurotags and these old associations to pain or to disease or to limitation, and to start to look at our own selves in a brighter, better light, is empowering, is what is a catalyst for growth and for change for any of us, whether we're a pain sufferer or not, right? And I think, I don't often talk about this, certainly not really in my money raising circles, as I'm not trying to raise money for the business. But what I feel really excited about is not only being able to help alleviate so much suffering in such a safe and effective way, but do it in a way that's really educational, as we've been talking about, and empowering people to start to make bigger changes in their lives. It's almost like a gateway where, we see people come into our clinic in a life that's so restricted because of pain. It's really robbed them of joy and connection and productivity and fulfillment in one way, or in many cases, many, many ways, right? It's really diminished who they are as a person. And so to be able to get them quickly kind of back to baseline, where the pain isn't a daily, or at least not consistently daily, presence that's just driving them down, they're back to a level of normalcy, or what we call the regular life, so a restricted life, radiant life, and then put them towards a path of going to what we call the radiant life, in which they're now empowered and they're educated and they're hungry, and they know, like, we're not going to become experts in all the things that there's so many other talented clinicians and professionals that are there, but if we can help open the door to that higher level of connection to mind, body, spirit, world, family, social, all the things that will help make somebody feel fulfilled and productive, versus the reality that they've been being robbed from all these years because of the pain, or the medications of the pain, or disrupted sleep from the pain, whatever it is. It's really exciting to be part of that. And we think that that's necessary, because just, another Band-Aid or another kind of like back to status quo, that's fine. But we want to just like take it another level. That's our goal.
Yeah. Well stated. I think I love what you're doing. You and your wife have an immense heart for people. And like I tell a lot of people, I just hope that all that you do brings more joy and less pain to people. And we need that more in this world. Yeah,
I couldn't agree more. And it's an honor to be part of something that you can see changing people's lives. You know what I mean? You can see that spark of hope, even in the first session, which again, as you mentioned, we give for free. And we do that not only to create a low barrier, but because we know that it works so well. We don't want somebody, even if they can afford it, which frankly most people can when they realize like how we price it, it becomes very affordable. Price is really rarely an issue. But when they come in and they get that spark of hope reunited, and we tell them, I mean, one of our values, one of our core values is do the right thing. And we tell them in our initial kind of consultation, when we're talking to them about their definition of success and their goal and their why and their history, and explaining our therapy, we tell them, look, doing the right thing means encouraging you to start, because talking about starting isn't going to give you the results. You have to do the work, right? So we're going to encourage you to do that. But at the same time, like you start getting down the path and it's not working for you for whatever reason, or you're not interpreting that it's working for you, then we'll let you out. We sell it on an annual membership. So we set the expectation that we're going to have, in some ways, a relationship with our clients over a year. And that allows us to push the pricing out over the year too, making it a little bit more affordable to people. But look, we're not here to bamboozle people. We're here to really help them get their life back. And on our website, in the marketing materials that we produce, are all actual clients whose lives have gone from whatever level of restriction to a life of normalcy that pain isn't interfering with anymore. And, that's what we want. I mean, we want just, oh, I think I'm better. No, that's not good enough for us. We want somebody really like going, I have my life back and I'm empowered to keep moving forward.
Yeah.
Yeah.
That's awesome. Well, I